Hello everyone. In this particular video we would be going over molar pregnancy, which is the final topic of hemorrhage in early pregnancy. So let's look at the definition first. So it is a type of gestational trophoblastic disease. So these are a group of disorders altogether, like completely different. So over here under this group we have molar pregnancy as one of them. So it involves abnormal proliferation of trophoblastic tissue leading to the formation of clusters of cysts resembling a hydatid cyst. That's why it's called hydatid form mole. So it is categorized into complete and partial moles. So even this one, molar pregnancy, has been classified into complete or partial. So let's look at each of them. Complete mole, no embryo or normal placental tissue is present. So none of this. It results from fertilization of an empty ovum, often showing 46XX karyotype. So fertilization of an empty ovum. But in case of partial mole, it coexists with an abnormal fetus or fetal tissue, often triploid 69XXY or 69XXX. So these are the key points that you need to remember. Complete mole, empty, completely empty. But in partial mode, there is some amount of fetal tissue. A good way to remember is partial mode contains partial amount of fetal tissue. Coming to the etiology, and that will include either X or Y. But in this particular case, it is 46XX complete mode. Coming to the etiology, common in teenage pregnancies and women over 35, and nutritional deficiencies, particularly low protein and keratin diet, previous molar pregnancy, and cytogenetic abnormalities. Complete moles have androgenetic origins because it is an empty ovum, and the males are and the sperms are the ones which give rise to it after the fertilization. So coming to the clinical features. So symptoms and signs. So symptoms include vaginal bleeding, dark prune juice like discharge, excessive vomiting, hyperemesis gravidarum due to high HCG levels. So this is different compared to the normal pregnancy, high HCG levels. Expulsion of grape-like vesicles per vaginum. This we have seen in pathology already. And absence of fetal heart sounds and quickening, because this is not a actual pregnancy. Coming to the signs, uterus larger than gestational age, pallor from hemorrhage, there is vaginal bleeding, and theca lutein cysts in ovaries in 25 to 50% of the cases, and snowstorm appearance, which is the key word here, on ultrasound. So these are the signs. Coming to the diagnosis, particular diagnostic tests. So quantitative beta HCG, which is elevated greater than 100K milli international units per ml. So this is the one, very high beta HCG. Ultrasound, again snowstorm appearance with absence of fetal parts, and partial in case of, and partial fetal parts in case of partial mole. Histopath, there is hydropic degeneration of coronary villi without blood vessels because it doesn't need it. Finally, coming to the management, there is suction evacuation preferred for most cases, and there is hysterectomy for older patients, family completion or uncontrolled bleeding. And in case of follow-up, monitor beta HCG levels weekly until normal for 3 weeks, then monthly for 6 to 12 months. Avoid pregnancy during follow-up to differentiate from persistent gestational trophoblastic disease. So avoid pregnancy during the follow-up time. Finally, chemotherapy. So it is not just these things, we also have drugs which can help. So there is one methotrexate and actinomycin D, which reduce the proliferation, so for persistent trophoblastic disease or high risk cases. And finally, coming to the complications. So what could go wrong? Hemorrhage, sepsis, uterine perforation and preeclampsia, and choriocarcinoma development in 2 to 10% of the cases. So then coming to prognosis, early detection is really good, and 15 to 20% moles progress to persistent GTD, gestational trophoblastic disease, which is persistent. So with this we come to the end of this particular topic, which is molar pregnancy, which was quite short one, surprisingly. But as I mentioned earlier, you can expand more on it to make it look bigger, but these are the key points. And that's it for this particular video. In case you liked it, you can like this video. In case you would like to see more of such videos or find more videos in the video library, you can do so, and make sure that you subscribe. Alright then, bye bye.